Hi, Dr. Mora here. Just wanted to show you a really interesting case. I'm at Restore Orthopedics and Spine Center in Orange, and this is what we have going on today here at the Outpatient Surgery Center. We have a left knee surgery. My camera is in the left knee. It's put in through a tiny little incision that's about this big, less than half an inch. Camera's inside, and then I put in another instrument through the other portal. So if you look over here, there's another little portal right there. I pop that in, and now this is what we have. We have medial side of the knee. Now before I start any case, I actually already have an idea what the patient has, and that's based on history and examination. So I already know that this patient is in the age range of a person that has a root tear. The mechanism occurred in a way that occurs with a root tear. A misstep, pop, pain in the back of the knee, and the pain doesn't go away. The patient eventually starts to develop a little bit of arthritis. As you can see, this fuzzy stuff, it looks like crab meat right over here. That's early arthritis. And there is a balancing meniscus right there. Medial meniscus, arch-like shape, starts over here, goes around. We have to follow it around, but this bone gets in the way, so we can't go straight this way. We have to go around the back. And this is how we get there. See this little cave right here? That little cave, and this is how we get in. If you look at my camera over here, you have to be really careful not to ding up the cartilage. So nice and easy, sort of squirm it in there into the back. PCL to my right, go all the way back here, and I'm pushing my camera into the PCL a little bit. You see, that way I don't scuff the cartilage that's on my left. So I push my camera this way and move in towards the soft PCL area, trying not to scuff, and then boom, pop it in, back it up a little bit. Now I'm in the back of the knee. See, I'm in the back of the knee. Look at my hand over here. And then you look over there. Back of the knee. Turn my light cord to the left. Back up again. And I've already started the repair. Now see, there's a gap right there. What do I mean by that gap? Well, you'll see in a minute. Let me put my instrument. This is where it gets really difficult to work because there's not a lot of space here. So I have to put my camera back a little bit, allow my instrument in, go back in, grasp this tissue. I'm going to pull it towards me, and what you'll see in a minute is the actual meniscus, because you really can't even see it. The actual meniscus is right there. That nice shiny tissue right there, that's the actual meniscus, which actually tore from this site. So I need to take some sutures and grab this meniscus. There we go. That's the root right there. That's what I'll be planting back into the bone, just like a good gardener, getting the soil ready, and then I'll be planting the root back where it came from. Just like more showing you what a root repair is like and the difficulty of getting back there and looking at it. Thank you.